So thank you so much for having me here today. Longtime fan of Dr. Lester, so I'm very, very happy to be here. So I'm Liron. I'm the Senior Program Coordinator at ANID. I run the mentorship program. And today I'm here to talk about a very important topic about self-advocacy, about how to navigate eating disorder treatment and the healthcare system. I know it's something that's on a lot of people's minds. And with us today is Dr. Rebecca Lester. I'm going to just do a brief introduction and then we'll dive right in because I know we have an hour and a lot to talk about. So Dr. Rebecca J. Lester is a professor of anthropology at Washington University in St. Louis and a practicing psychotherapist specializing in eating disorders, trauma, personality disorders, mood disorders, and gender and sexuality issues. In 2010, she started Lumen Psychotherapy, a nonprofit organization that offers low-fee mental health services in the St. Louis area. Dr. Lester is the author of two award-winning books and numerous academic articles. Her most recent book, Famished: Eating Disorders and Failed Care in America, my copy, and you see how much I loved it, uh, published in 2019, presents a profound rethinking of eating disorders and examines how a system set up to treat these illnesses ends up perpetuating them. She's currently writing a book about dissociative identity disorder, conducting research on the practice of polyamory in the contemporary United States, and initiating a new project on psychedelic-assisted therapies. And with all that going, you still made time to be here with us today. Thank you so much, Dr. Lister, for being here.
Oh, thank you for having me. It's really an honor to be here. So I'm happy to be here. Thank you.
Yeah, well, I think we're just going to dive right in and start talking about really, navigating eating disorder treatment, navigating the healthcare system, especially in America, can be really daunting and overwhelming, quite a terrain to get through. And I think a lot of the questions that come up for us kind of pertain to some of the conflicts that exist, I guess, within that system and in trying to heal while navigating that system. And I think the first thing that comes to mind to me is how do we talk a lot about the eating disorder voice that we have and how do we separate the eating disorder voice from our authentic voice. And so when we try to find treatment or when we're in treatment trying to find providers, how do we know whether a certain treatment or a center, a treatment center or a provider, whether they are right for us or wrong for us? And how can we tell if it's truly us or if it's that eating disorder voice kind of trying to resist recovery and mislead us?
Right. Such a great question. And I think, it's really important to recognize that, of course, the eating disorder is going to be very activated when somebody goes into treatment. I mean, of course, that's natural. And it's going to be screaming at you that this is wrong and you should leave and all of that. So how to distinguish between that and the fact that there may actually be a problem there and that maybe it's not the right fit for you. So some of the things to really look at that would be programmatic red flags are things like if a clinic or setting does not have an individualized treatment plan, if they have a very punitive or shame-based approach, they don't use evidence-based therapies, they have inexperienced staff, that's not uncommon. See, these things I'm saying are not uncommon, but there are things to look at. A big one is a lack of transparency. Because if you are receiving medical care, you have a right to have information about your status and about your treatment to a point. Obviously, there are some things that in an eating disorder, they may not share with you, like your weight or whatever. So there can be select things that it is appropriate to maybe not disclose, but everything else about how decisions are made, what those are contingent on, all of that should be very, very transparent. And so one way to discern if is this my eating disorder telling me to leave or is there really a problem here? Is first to really reflect internally and think about what is mostly motivating me here? Is it really that I don't want to do the food? Is it that I don't want to gain the weight? Am I having familiar eating disorder thoughts? And the answers are probably yes to all of those. It doesn't mean that gets the treatment center off the hook. It's just good to recognize that is also going to be going on. You should first try to talk with your treatment team, ask for clarification, express your feelings, see how that goes. If you're getting a lot of pushback or you're getting secrecy or anger or judgment, make note of that. talking to trusted people outside of the system, whether it's family, but that can be complicated. So other friends or people that you know say, here's what's going on. Like, how does this sound to you? Kind of check yourself with somebody else. Observe other people in the program, see if they're having similar kinds of struggles, and look for patterns that are problematic. So again, this can be very confusing because the eating disorder will try to convince you of all of these things. And so I think the most important thing is to not make a rash decision, but to take your time, document some things, really look around you and try to separate out as best you.
Let's see. Is this on? Larone, is it frozen for you too?
Yeah.
All right.
Yeah, it must be your Dr. Liss's connection.
Hang tight, everyone. Dr. Lester might have had some internet problems there.
Yeah. I'm talk about a cliffhanger. I want to know more.
I know. We were just talking about that before we came on.
Yes.
Yeah, all right. So
Okay. Hopefully she'll log back in.
yeah. And while we're waiting, I want to thank everyone while you were registering for submitting your questions. We're excited to get to some of your questions here today because there were some really good questions that came in. It wouldn't be an Anid event without a little bit of technical difficulty, but at least this one's not weather related. Sometimes it's weather related when I'm involved. So
But you love it when it's weather
I love it.
related.
Yeah, yeah, I do.
Yeah, we've gotten so spoiled thinking that we can just talk to anybody across the world at any time, and we forget that there's a lot that goes on into making this happen.
Yeah. All right. Thanks everyone for hanging tight with us. We're hoping to
And
get Dr. Lester back here shortly.
I'm just gonna
Yeah.
again plug this book. I really, really recommend it to everyone. I think it's a very eye-opening book to anyone who is navigating the healthcare system in America, but even to people who have navigated the healthcare system in America and just validating a lot of experiences and feelings.
Yeah, I'm so glad we're able to have this conversation and that there's resources out there like this book because for me, one of the things that I found was asking for help was almost easier than finding it or advocating for myself after I asked for help. And I think that we often forget about that, like especially when we're raising awareness or trying to break through the stigma, we're thinking about getting people to help, but we don't realize that once they're there, the work's just beginning, the journey's just beginning, and there's so many barriers and roadblocks along the way.
It's true. So many confusing messages, so many, even just, figuring out how to find a provider, insurance, how to talk to insurance. Um, I think one of the first questions that people ask is, where do I start? Who
Yeah.
do I talk to? Where do I go? Where do I look for these things? Where do I find them? There we are.
Yeah.
There we are. We just talked about a cliffhanger, and here you are. You left us with a cliffhanger.
I'm sorry, I have no idea what happened. I'm now tethered to my phone, so hopefully that will not happen again. I apologize, everybody. My goodness. Okay. So
Technology
we were
has.
saying, yes, as we were saying. So yeah, it's not going to be fun. I mean, it's a thing to recognize that eating disorder treatment is not fun. It's very uncomfortable. It involves a lot of fear, a lot of stress, a lot of anxiety, trauma to some extent that we will talk about later. So as best that you can, rely on your support systems and do a lot of self-reflection about, what is really going on here? Is this ultimately going to lead towards my recovery, or is this something that's really needs some more thought about whether or not to continue?
Yeah, thank you so much for that. And you mentioned when you mentioned some of the red flags, as you mentioned them, I was thinking, and you said it later, well, all these things will exist to some extent in most treatment. And it's true that when I think about sometimes some of the labels that some people get attached to them, like chronic or resistant to treatment, or sometimes we hear things like manipulative, or all sorts of things that talk about shame or devaluing, or it's sometimes built into the treatment as and considered a legitimate part of treatment. Um, so there's this paradox that we, on one hand, need to comply in order to be successful in treatment. And on the other hand, a huge part of the recovery work is trying to find our authentic voice, trying to learn how to listen to ourselves and give ourselves that validation. Or I'm thinking about another paradox, which is the eating disorder voice that oftentimes tells us we're not sick enough to receive treatment, and then we get denied treatment. So, in effect, echoing that eating disorder voice from the outside, or sometimes they'll tell us we're not, we're too sick to receive treatment. So how do we even begin to make sense of all of that and kind of advocate for ourselves, even just knowing our feelings are valid and our experience is valid.
Yeah, I think part of that, and this is a lot of what Famish is about, right? Is this kind of ways that there are all of these double binds that kind of figure patients in such a way, or clients, however you want to term that, where there's a no-win situation, right? So I think it can be very helpful to recognize that that is part of the way the system works. And that it's, we get as clients are going to get caught up in that system, and we're going to be set into these double binds, and that's going to make things very difficult. But it can also be very helpful to recognize that there are bigger structures at play. It's not just you. That doesn't make it go away, but it can help a little bit to depersonalize what's going on, which can be very helpful. But I think it's really important when you're thinking about how to advocate for yourself in treatment to think about what advocacy is and what it isn't. So the way I think about it anyway, advocacy is being an active partner in your treatment. It's knowing your rights and responsibilities. It's clearly stating your concerns, and it's proactively seeking solutions to things. So what it's not is demanding things be done a certain way, getting other people to accommodate the eating disorder, because that can feel very logical and very reasonable, right, at the time. So it takes some real critical self-reflection, or resisting treatment out of a place of fear or anger. So those are some ways to think about, kind of some more ways to kind of pull that apart about what might be going on. And also to recognize that with advocacy, when you advocate for yourself, that comes with responsibilities also. If you want to be a full participant in your treatment, then you need to be a full participant in your treatment. And recognize also that having a voice in what's going on doesn't mean that it's automatically going to go the way that you want. Concerns can be taken seriously, and things still might not turn out how you would like them to. It means collaborating with your treatment team with the ultimate goal of healing. So that's being, honest yourself. If you're expecting them to be transparent, it's only reasonable that you are also transparent. And if you perceive problems, can you offer constructive solutions and not just be in a place of criticizing what is not happening? So I think, these are things to keep in mind in the process of advocacy. Now, all of that said, people are in treatment because they are in a very, very difficult place, and you're not your best self or you wouldn't be there. And so that's a lot to be managing the eating disorder, getting riled up and all of that, and also thinking about the advocacy piece. But again, I think recognizing that a big part of it is the systemic structures that are around you, and then figuring out how to work within those. And there are some, there are these strategies that you can use to really kind of take it out of the personal a little bit as much as possible and see, okay, how do I work with this broken system?
Wow, I have a feeling that after this, I'm gonna have to rewatch it, pause, and take notes of all that you just said because there's so much important information there, and I feel that even what you're describing is already kind of doing recovery work because people talk a lot about control in the context of eating disorders. I love the word agency better, and I feel like what you're describing here is how to take agency, how to find your agency even within treatment, at the same time as having kind of radical acceptance that this is the system and I can't change it, but what do I have agency in? So that was beautiful. Thank you. There's a term that you mentioned in your book that is also very interesting to me, and I think it's again not talked about enough, which is flight into health.
Yes.
Can you talk a little bit more about that and describe it and elaborate?
Yeah, sure. So flight into health is when somebody is in treatment and starts to make progress towards recovery. And then there can sometimes be this like we want it so badly, and we know the people around us want it for us so badly that there can be this temptation to really think, okay, I've conquered this now. I got it. Okay, I get it. I understand. I can do it now. And to kind of leap over that middle part of recovery that is really where all the work is happening. So there can be definitely a temptation, not conscious, but there can be an excitement when you finally see a light at the end of the tunnel. We all know how horrible it is to live with an eating disorder. So when you finally see like a glimmer of hope, it can be so tempting to be like, okay, I'm good. I got it. Let's, barrel forward and to you got to slow down. And there's a lot of work to do. And it's good to keep that glimmer of hope, absolutely, but to not skip over all the stuff in between. And so sometimes people can get into some challenges if they leave treatment too early or the treatment discharges them too early, because insurance companies are guilty of this as well, of like, oh, she, gained X number of pounds this week. Great, she's all better. She can go, so this is a theme. So you have to be very cautious of that.
Yeah, so much of, as you said in your book, so much of the eating disorder voice gets amplified by the healthcare system and insurance, and so it is a lot to navigate. So I guess kind of like maybe a concluding question to this segment would be how to remain collaborative while also advocating for ourselves. And I know you covered some of it, but just
Yeah, I think there's some strategies that you can use that, again, I love that, thinking about it as agency, because that's what it is. It's not about control, it's about having agency. And so there are some concrete strategies that people can use. So you want to, when you're communicating with your treatment team, for example, so if you're going to be a collaborative partner, then you have to show up, you know, in the treatment. So you have to communicate because people cannot read our minds. And unfortunately, that would make everything a lot easier in some ways, but it's just not going to happen. So you want to be really prepared when you're going to talk to your therapist, your case manager, or however they structure it where you are. You want to be prepared, write down your questions, your concerns, and your desired outcomes before the meeting. When you communicate, use I statements, talk about how this is how you feel, what you need, instead of saying things like, well, they changed my meal plan, or, this is too much, or, focus on you and how you're experiencing it. And ask for clarification. If you don't understand something, why a decision was made, or whatever's going on, ask for clarification. They should be able to explain it to you clearly. Even if you don't agree with the explanation, they should explain it to you. Take notes when you're discussing these things because it can be very emotional and you're going to want to be able to remember what people said afterwards. If you have specific concerns about a staff member, go to that person's supervisor and raise it. So these are, the kinds of things that we can do. So documentation, education, identify your goals, and communicate with folks and take notes, because you need to document everything, not just what you intend to say, but what is communicated to you in a given situation.
yeah, I love that. Again, you become an active agent, a real active agent in your own recovery, which is already a huge part of recovery. So that's wonderful. Thank you so much for all this really great advice. I know Jason has some questions he wants to ask too.
Can I add a little addendum to this last?
Please.
Yeah. it's very helpful to learn to speak their language. So clinics operate with a set of rules. They have, clinical ethics and clinical guidelines. They also have what the insurance company is telling them. They are operating within all these structures as well. So the more that you can learn to speak their language and understand what their concerns are, the more clearly you're going to be able to articulate your own concerns and how you want things to go.
And how do you recommend somebody go about learning that language?
Um, it's a lot of listening and paying attention to how they talk about stuff. How do they talk about the eating disorder process, recovery process in groups? What kind of language do they use to talk about, somebody who doesn't want to follow a particular set of guidelines? Just kind of trying to understand their terms that they use, like the literal words that they use, and to understand that they're a business. So there's that component too, and that does not necessarily make them evil, but it does mean they're operating within a set of structures that is going to shape how they're responding to people.
That is so important. Thank you so much.
Yeah, all right. Thank you. One of the areas that I kind of wanted to touch on today is accessibility to eating disorder treatment. And one of the questions that I had kind of pertains to, I guess, my own experiences. I ended up having to work with an outpatient team who did not specialize in eating disorders. So I'm curious, what are maybe some green flags? What are things to look for in working with treatment providers who maybe don't specialize in eating disorders?
Great question, because, as much as we hear you should find somebody who specializes in eating disorders, that is not always possible. It may also be you already have a therapist that you like, and you're not going to just, stop seeing them. So what are some things to look for? The kind of basic things you want to look for in therapy is whether or not you feel heard and seen, of course. Can you talk about things that matter to you? Are your feelings being validated? And this is not the same thing as validating the eating disorder behavior, but really kind of understanding your feelings and recognizing that those are valid feelings to have. The therapist should be non-judgmental. Again, that doesn't mean they're always going to say what you want to hear. They may say things you don't want to hear, but that can be done in a compassionate way, right? Are you constructively challenged? Do you feel the need to hide things? That's something that should be a red flag to you. So that is not a green flag. That would be a red flag to you. And how they manage boundaries. You want to really, it can be very compelling for a therapist to share a lot of self-disclosure, especially when you're struggling with something like an eating disorder. And some of that is okay, but to be kind of checking out, is that serving you or is it serving them? So somebody who does not have experience in treating eating disorders could still have a lot of these qualities that make them an excellent therapist. You would also want somebody who is curious to learn. If they've never treated an eating disorder before, and that's clear that's what you have, they're going to want to be curious. They should be asking you questions about your experience. They should be asking for, if you happen to have any recommendations for books, they should do their own outside research on getting educated. So, it's quite possible for somebody without specialized training to still be a very productive therapist, but they have to be open to learning. And not kind of falling into the trap of some of the stereotypes of eating disorders that pervade the public domain, but also therapeutic communities about people don't want to get better. People are always going to resist. They're going to be manipulative. So you want to, be alert for signs that might be part of their framework and see if there's a way to educate them otherwise. And it is work. I mean, on the one hand, you're going for help and it can be frustrating. Like, why should I have to educate my therapist? But that's how it is. If you want to get help and you want to work with this person, you need to help them understand, because you are like, I'm an anthropologist by training. So it's like you are their key interlocutor or informant, and you are sharing with them what it's like to live inside this. And so as long as they're curious and they're going along that journey with you, then there's a lot of potential there.
Yeah, and that was one of the things that I really commend my team for, is that they were willing to learn and grow with me in this. And if in any case, it made me feel empowered throughout my recovery because I knew they almost needed me as much as I needed them. If they were going to be able to do their job, I had to be open and honest with them and really share what I was going through. So it was an empowering part of my recovery. So definitely just because somebody isn't an eating disorder specialist doesn't mean they can't help, especially when eating disorders are caught usually a combination of so many contributing factors. I had to work through anxiety, I had to work through OCD and trauma and all those things, and a lot of therapists can work on that, and that's well beyond the eating disorder community. Another area that I wanted to touch upon is around insurance companies and perhaps their agendas, or perhaps the situation when somebody runs into being prematurely released from a higher level of care. That can feel really demoralizing. It can feel discouraging. It can reinforce the eating disorder voice. So, what advice would you have for somebody who's navigating when that happens?
Yeah, it can be extremely demoralizing and scary and frustrating and anger provoking and all of that stuff. It's important to remember because insurance companies, they are for-profit businesses. They are there to make money. That is how it functions, not just in health insurance, but insurance in general. They take in premiums and they want to take in more premiums than they pay out in payments. So this is their motivation, right? It's just how it is. So it's important to keep that in mind, that these decisions are not about you personally. They are about profit and loss. And that can feel horrible. That can feel almost worse, right? That's like, it's not even about me that this is happening, but it can be helpful because then it opens up some other ways to think about it. So the way I think about it is there's treatment and then there's recovery, right? And so treatment is what involves the money, the institutions, the policy, decisions that are made without you in the room. Like that's what treatment structures are. Recovery is the actual work you do to get well. And while we cannot control what an insurance company decides, we can control, we can have agency to show up and engage in our recovery. It's not fair. It's not going to be fair. This is a hard pill to swallow. But ultimately, your recovery is about you. And so insurance companies are these, big corporations that are making decisions elsewhere. But what happens every day, what you are doing in your own recovery is what is the most important thing. So remembering that treatment can be very helpful, but treatment in and of itself will not save you. You are the one who's going to do that. And so what heals is the hard work that we put in. And so get mad at the insurance companies, be frustrated with it. It's a ridiculous system. I write about this a lot in Famished. So, that is going to be a frustration, and you can't let it derail your process of recovery. So that would be my advice.
That's a really good point too, because I tell people all the time is so much of recovery takes place outside of a medical office.
Yes.
And that kind of plays into one of the questions that we got here in the chat too. But what are your thoughts about the other support options that are available out there beyond maybe just the traditional treatment care that we talk about, such as, scaled up outpatient care or peer support groups here at ANID, meal support, community support groups? What are some of the additional resources that are out there, and what would you recommend people seek out?
Well, there's a lot of things. You've mentioned a good number of them there. As people know, there are national organizations that also have other information, like the National Eating Disorder Association has a bunch of information that's available. Project Heal is a great advocacy assistance. Again, though, I would say to not limit yourself to things that are just about eating disorders. Like those are very useful, and definitely take advantage of what's available, like the programs that you guys have. But don't limit yourself to that. There are other things that, maybe are about depression or anxiety or OCD or trauma or things like that, that can be a great support that don't take place in a clinic or in a hospital, that are available in the community. So, my best advice is to go to your website, to go to the NIDA website, to go to Project Heal, and take a look at all the resources they have available there. And also look in your community for things that maybe aren't specifically eating disorder related. But I think all of those things, the extended outpatient, one of the things that was very frustrating when I was doing the research for Famished was this recognition that we do not have good continuity of care for most part when people are in intensive treatment, and then they're sometimes just discharged home with like a once a week therapy appointment. Like that's not sufficient usually. So all the things you mentioned, getting involved in peer support groups and all of that kind of stuff is use all the support you possibly can.
And I'll just throw it out there, and it's accepting mentee applications right now. Lerone would be very proud of me for giving that out there. But one more question that I've got around kind of the accessibility piece is relationships. Relationships that we build in treatment, or even just the opportunities that we have to build relationships. I think we so often overlook that, and we think maybe about recovery as repairing relationships, but there's also opportunities to make new relationships in our recovery journey. Could you talk a little bit more about that?
Sure. I mean, for anything, when people are going through a difficult or traumatic experience together, that is, energy for bonding, right? And there are ways that can be healthy and ways that cannot be so healthy. So it's important to kind of be aware of that. But yes, when you are going through treatment and recovery, you are with other people who know what you're dealing with and can be a big support. What you have to be aware of is that sometimes those relationships can become kind of competitive or not the healthiest. So be, really kind of gut check yourself about how do I feel in this relationship? Do I feel like this person really wants to support me in my recovery? And do I really want to support them in their recovery? And if those two things are true, then it can be like one of the most profound ways to build a relationship that can last for years, for sure.
Cool. That's right along the advice that I usually share. And it's ask yourself, do you want to connect with this person, or do you want to compare yourself to this person? And I think that's so important when we're going through treatment and recovery, because the comparison game can be really toxic and harmful. But if you really want to connect with people, it's a great opportunity to do it and build each other up.
Yeah.
Um, yeah. So with that, I'm going to go ahead and pass it back over to Larone to talk a little bit more about finding empowerment.
Yeah, and a great place to find relationships with people who understand you and who will empower you is Anid. Just just putting it out there. One of the most powerful statements that you made in the book was clients do not fail treatment, treatment fails clients. And even just that one statement, I had to sit with it for a while when I read it. So can you talk a little bit about that? Because I think that's a really important point, that again, going through treatment can feel demoralizing, can feel all these. I mean, we come here to heal, and we oftentimes end up with a lot of other feelings that are very difficult. So yeah, just whatever you can say about that.
Yeah, I think it's important to remember. It seems obvious, but good to remind yourselves that when people go to treatment, it's because they need treatment, because they are struggling, because they are ill, because they are not functioning, right? So a lot of times with eating disorders, it can be confusing for people on the outside, because a lot of times people with eating disorders are very smart, articulate, capable in lots of areas of their lives, but this area not so much. So you're going in needing help, and if things don't work out, barring a person just very blatantly not doing anything at all that the treatment team is asking you, it's the treatment that's not working. You didn't fail. I hate that language. They talk about that in the clinical world, that so-and-so failed treatment. And I hate that so much, because it just puts such a stigma on the person, and it puts all the responsibility on the person who needs the help to be the one to make it work. And, yes, we have a part, but we we don't control the whole situation. And so putting that responsibility on the individual client for failing treatment, I think, is very harmful. So I think it's just recognizing, and again, this is not to demonize the clinicians who may be doing everything possible they can do, and genuinely want to help people get better, but that doesn't mean that the treatment's going to be sufficient. And so I think we have a long way to go in how we understand these conditions, how we, what kinds of therapeutic modalities we use, how we think about treatment. There's such a long way to go on that end. And so blaming the client for failing treatment is just a big scapegoat, in my opinion.
And something that they would never do for so many other conditions, illnesses, disorders. Nobody would even imagine blaming the person who is suffering for not succeeding in treatment. So, yeah,
it's a kind of cliched comparison, but if you have cancer and you're going through chemo and you have a recurrence of your cancer, did you fail your chemo? No, you did not.
Yeah,
there's other explanations.
Yeah, that perspective does seem to be reserved for eating disorders. And so it's time that at least we for ourselves destigmatize that.
Right.
And people who, a lot of the time, people who have eating disorders, who struggle with eating disorders they do tend to be very empathetic and very compassionate and sensitive. And I think we do tend to sometimes take responsibility on ourselves for things that we don't really we shouldn't take responsibility for. And so how can we be our best ally? How can we treat ourselves better as we go through these, navigating all of this?
Yeah, it's so difficult. I think, radical self-compassion, which does not mean endorsing the eating disorder behaviors, right? So those are two separate things. But compassion with your experience, compassion with the pain you might be feeling, with the sadness, with the hurt, the fact that you are at a place where you need this kind of help, to have compassion and not anger at yourself or guilt or shame or the feelings that often go with, getting to the point of needing treatment. And so it's a lot of kind of pushing back internally against some of these narratives that are circulating, even within clinics, about who the people are who get eating disorders and how they should be treated. That they're manipulative or they're liars or they don't want to get well, all that stuff. And I have not met a single person, even somebody who's extremely in their eating disorder, that wouldn't prefer to be without it. If they could imagine a life where they could be without it, they would choose that. So having compassion with yourself and trying not to internalize all of these negative stereotypes that are circulating.
Yeah, and I think that here really community can play a big role, because even realizing that there are so many people like you, looking around and seeing that a lot of the community, I find that the most special, wonderful, kind people in this community. So even just understanding that this community is full of beautiful, wonderful people who are, struggling with the same thing. There's
I'm sorry.
No.
A lot of the things that may predispose us to eating disorders, like you're talking about, those are like superpowers. Actually, they are directed in a place that is self-destructive. So that's the problem. The problem is where they're getting channeled. The problem is not who you are. And so, like, all this stuff about being goal-directed and being disciplined and being empathetic and, all of this stuff, these are great qualities to have, and they can serve you very, very well in your life when they are not channeled into an eating disorder. So just to remember that there's nothing wrong with you. It's just a matter of figuring out how to make that energy go somewhere else.
That is what I would like every person in our community to hear every morning and every night before they go to sleep. And you mentioned this a little bit earlier, but the subject of experiencing trauma in treatment, experiencing trauma from treatment, it's something that we don't talk about enough, but it does happen a lot more than we would like to acknowledge. Can you talk a little bit about that, and how do we cope with that? How do we handle that?
Absolutely. So there's a lot of things that can be traumatic in treatment. The loss of autonomy and agency is a traumatic experience if anybody's been through that, it's you're ripped out of your life. And not just that, but you have no say over anything, really, at least at the beginning, when they're trying to figure out what's going on. Like, you don't have say over things. And that is terrifying. And I think any human being who is put in that situation would probably feel the same way. So people talk about like, oh, it's because, you want to control everything. And it's like, no, this is like a radical shift from the way that we live our everyday lives. So there's that. There can be coercive or punitive measures depending on what's going on. Some of them may be necessary to save your life, but that doesn't make them not traumatic. The invalidation that a lot of times people experience while in treatment, and the focus on weight at all costs, which is, one of the ridiculous double binds that I talk about in Famished, is that it's like, oh, you're more than your weight and your weight shouldn't matter. And why do we care? We're not going to tell you the number, but yet we're going to chart the number and we're going to make decisions about your treatment based on whether it's this many pounds up or down or the same or whatever it is. So how do you address all of that? I think one of the most important things to start with is just to acknowledge that. I never really thought about treatment itself as traumatic until the past couple years. I don't know why. It just didn't, I just thought it was a horrible thing I went through. But to kind of think about the trauma of it, it shifts it, at least for me, and having a lot more compassion for myself and how difficult it was. You want to prioritize your physical and emotional safety at all times, using trauma-specific modalities like EMDR or other kinds of things, if it's to that extent that you're having those kinds of challenges with flashbacks or, really having trouble getting past it. Work on rebuilding your sense of autonomy and trusting yourself. So this comes with all of those ways that you can exercise your agency, and with time, you'll learn to trust yourself. We're taught, especially in treatment, that we can't be trusted. We can't trust our hunger and fullness cues. We can't trust our thoughts. We can't trust our emotions, right? And there's work to do there, but that doesn't mean that we have no capacity for anything. So learning slowly to trust yourself again is really important. And focusing on the collaboration with your recovery, and that this is about you. This is ultimately not about the clinic or about the clinicians. This is about you and what you need, and keeping that first and foremost in your mind.
Thank you so much. I mean, I feel this conversation has been so validating for me because just like you said, I think the understanding of how traumatic certain experiences that were supposed to be healing for me were, and how some of my beliefs about myself were shaped in the context of I can't trust my own mind. That was something that I had to, after finishing working on my recovery, I had to work on healing from that. So that's kind of an extra added something nobody told me I would have to do. I just kind of had to figure it for myself. So I think it's really important that we talk about this, and that people do know and understand that this is something that is definitely happens to a lot of people and is, again, very valid. Thank you so much for sharing that and talking about it. I believe we have some questions from our participants that we want to ask now too, right, Justin?
Yeah. So we had some come in on the registration form that I'm really excited to dive into. And a couple of the questions kind of focused on parents or caregivers. So how can they be advocates for their children or a loved one in a medical setting?
Right. This is very challenging. If they're minor children, it's a little easier than if they're adult children, which I'll talk about in a second. But I think the most powerful tool that we have is educating ourselves. So as a parent or a family member, the first thing you want to do is learn as much as you can, obviously about eating disorders, but also about the treatment process. You want to not be shy about asking the treatment center, what is your philosophy of X? What do you do in the case of Y? What is your policy about this or that? And be actively engaged. Pretty much every treatment center that I'm aware of has family engagement to some extent. If there's a treatment center that takes your minor child and does not let you have access to them and does not involve the family in some kind of substantial way, I would be wary of that. So as a family member, educate yourself, be active, ask questions, and at the same time, encouraging your child, and this is difficult, encouraging them to be as introspective as possible and to learn very slowly how to discern kind of what is motivating me. Is it fear, or is this something that I think will actually take me toward recovery? One of the turning points for me in my own recovery when I was in treatment, when I was 11, the first time I was in treatment. And so as a minor child, I have some experience with that. But one of the key turning points was one of the psychiatrists asked me, what do you think you need to get better? And nobody had ever asked me that before. They didn't care what I said because they would assume it was manipulation, right? So I think encouraging your child to, be open and honest, build those relationships that we've talked about, and to continue to kind of sense their kind of core hope for recovery.
Awesome, thanks. And then did you have some additional stuff for maybe adult children or another loved one?
Yes, adult children is challenging. I have 2 adult children myself now, so I know that is challenging when you want them to do things and they will not do it, or vice versa. So, there's only so much you can do when your child is an adult. You're would want to really encourage them to self-reflect. Now, it may be very difficult. If somebody's in the state where they need to be in treatment, that piece may not be there for them right now. They might not have resources internally for that sort of thing at the moment. But the best you can do is to tell them that you love them, that they're doing the right thing. I think this is very important, that people can second guess their decision, especially if you're an adult and you can technically check yourself out at any time. To be reassured that, yes, this is hard, validating that this is going to be very difficult. I understand that you don't like this thing that's happening. That really sucks. And I see why you're angry about that. But you are doing the right thing. There's always, in the extreme cases, the option of medical guardianship, but hopefully that's a rare necessity. I have seen that happen before, where parents had to get guardianship over an adult child to keep them in treatment, but that's pretty rare. Yeah.
All right. And then I guess talking to a different part of our audience is we had somebody ask, what do you recommend for clinicians working in higher level of care who are trying to balance patient autonomy with directives that are coming in from leadership?
Yes, this is extremely difficult. As part of my research for Famished, I worked as a therapist at a clinic. And so I have that experience of knowing what that's like, where you're really caught as a therapist between the insurance company, the clinic policies, what you might think is best for the client. So to recognize that you're put into kind of impossible situations, it's important to voice those concerns to the leadership of the clinic. They may or may not listen, but it's important for your own sake to voice those concerns, have the data to back it up. Say, here's what happened with this client, this client, this client. Find spaces for client autonomy and choice within the structures wherever possible. So whether it's, do you want to, do your pass at this time or that time, both of which are essentially equivalent in terms of treatment. Just little places where somebody can have choice, and offering that to clients, and supporting them in making those kinds of choices. And then as a clinician, you should definitely have your own support. I mean, all clinicians should, but specifically in working in this setting where it's so challenging. And I should say, it's not challenging because of the clients. It's challenging because of the situation and the structures around treatment. So those would be some of the things I'd recommend.
Awesome. Thanks for sharing those. Another really good question that came in, and I think it's perfect for our conversation because we've been talking about self-advocacy, but how do you know when to stop? When can it become counterproductive? When can it become too much?
Right, right. It's counterproductive when it starts to take you off the path of your own healing, or it's becoming a way to avoid doing the hard steps of recovery. Right? Because those lines can blur between I'm advocating for myself, but I'm advocating in the wrong direction. Like that can happen. So if that is becoming a way to avoid, if we're always talking about how the clinic sucks, or things are not fair, then we're not talking about the issues we're here to talk about. So again, keeping your own recovery front and center and what is serving you, and actually making that trip toward health. And, that's hard. It can be very hard to piece all this out when you're in the midst of it. So again, that's where trusted outside people can be helpful. Even if it's somebody else in the clinic, that if you've built a good relationship with somebody that you are both supporting each other, they can help you with that as well. So sometimes it does really help to get an outside perspective.
Thanks. Another question that came in that got me thinking is it's around how does advocacy look different for co-occurring conditions like OCD? But to kind of take it one step farther, I hear it a lot from people who are battling substance use disorder as well, and they're passed around from facility to facility, or they've got to treat this, then they can treat that, and it can get very frustrating, very overwhelming. What kind of tools or resources do you have for those folks?
Yeah, that can be very frustrating. And again, this is the structure of our healthcare system, that this is how people end up getting passed around to different, things. Well, we have to treat the alcohol addiction before we can treat the eating disorder, or vice versa, or however they, whatever. Um, so I think it's the same kind of things that I recommended before. Ask questions, be clear. It should be transparent why these things are happening, even if you don't agree with them, even if like this is the only way you can get treatment or you can get that support, then do it. Just complaining about it won't get you anywhere. Um, but you can still advocate for yourself by being collaborative in your treatment, by learning to speak the language of the people who are making these decisions, by speaking up. It can be very hard. That can be some of the reasons why people develop these things in the first place, is that it's difficult to speak up for yourself, right? So this is a place to start practicing that. And it can be incredibly scary and difficult. But if all else fails, there are a couple of organizations that can help with advocacy around insurance. And so Project Heal is one that has a number of resources on their website that you can look to that can help with some of those. And I think reminding people that you are one whole person. Like your eating disorder is not separate from the OCD, is not separate from the depression. Like this is all living in you as a whole person. And just reminding people of that and trying as best you can to incorporate that work into the other pieces that are going on.
All right, thank you. And so those were some of the questions that came in. We do have another couple minutes here, so if anybody who's currently watching wants to pop a question or two in the Q&A, definitely feel free to. Lerone, do you have any additional questions?
I was wondering about something that does come up a lot, about, especially in treatment center, either people who are from the LGBTQ plus community, or people whose eating disorder is ARFID, or neurodivergent people. And they oftentimes say that again, when they ask for accommodations or when they ask to be treated as who they are blamed that, no, this is your eating disorder trying to ask for these different accommodations or ask to be treated a different way. So I know of people who are actually avoiding going into these settings because they don't want to have to struggle with that. Anything you can say to those people?
Yes, that is a real issue. Part of that work can happen before you even go to a treatment center, that this needs to be a topic of conversation. It needs to be discussed. There needs to be some clear decisions made. Obviously, other situations will come up on the fly that people have to decide about. But if a clinic is unwilling to make any accommodations for you in these kind of circumstances, then that's not the clinic for you. If you find yourself that you really need eating disorder treatment and that's the only way you can get it, that's a decision you have to make. I myself would probably recommend somebody go ahead and do it while recognizing that this is going to be limited and there's going to be these problems. But speaking up about what you need and, naming the mismatch between, what a clinic says and what they're actually offering is really important. Not that it's going to change the whole structure, but it's important for you to acknowledge that and to say that, in my opinion, this is part of the building of agency.
Again, it sounds like so much of the work of self-advocacy in those spaces is already the work of practicing recovery, of finding your voice, of validating who you are and your feelings and naming your feelings and empowering yourself. So I love that. Thank you. Jason, I didn't see what was going on in the chat, but if you have any questions, then
Yeah, so one question that did come in is what are the best supports for clinicians who are working in an outpatient setting?
Mm. Yeah, there's not a lot actually specifically for eating disorder clinicians, which is too bad because as I've said, like I think they face particular challenges. You can and should, I think, it's a really good idea to have a supervision group that you go to. It does not have to be all other eating disorder clinicians. Any kind of, so a supervision group is when a bunch of therapists get together and they kind of talk in an anonymous way about cases that they're dealing with and get input from other therapists about things, and they can explore, the feelings they have about the treatment and things like that. So absolutely get involved in something like that. Also having your own therapy going on, but there's really not a lot specifically for clinicians of eating disorders. And so I think that's a real missing piece.
Yeah, definitely an area of need still in the community. So one last question came in here about seeking treatment when you only have Medicaid or Medicare. So do you have any tips or tools, resources there for someone who's trying to navigate the system with Medicare?
That is very challenging. The National Eating Disorder Association can be helpful with that. They have some people that will help find treatment for people with Medicare. It is very challenging. There are initiatives that are going on. I know in the state of Missouri, and I'm sure around the country, that are looking to add eating disorder services to Medicare eligible community health centers. So you can keep an eye out for that. But I would go to NEDA and look at their treatment navigator assistance and see what they can do. But that is a challenge, and it's again a real big missing piece.
Yeah. Yeah, and people can definitely reach out to our helpline too. We have our treatment referral program, so we're always there to help you find resources as well. So definitely give our helpline a call. Time for one more quick question here. And what advice would you give to someone that, due to moral or religious convictions, wants to maintain a vegan, vegetarian diet and treatment? And how can they tease apart whether the motivation for maintaining that diet comes from the eating disorder thoughts or for other reasons?
Great question, because a lot of religious denominations do have a practice, practices around food and things like that. So that can be totally legitimate. It can also be kind of hijacked by the eating disorder. So that's an important piece to keep in mind. I would say, imagine, so, if you're saying I'm going to have a vegan diet or vegetarian diet, and all I will eat are cucumbers, that's a problem, right? But if you imagine, like, okay, well, if they served me some sort of lentil stew and this and that and the other thing, like how would I react to that? If I am reacting like I'm scared but okay, then that's fine. If you are reacting like, oh no, I would never do that, that's your eating disorder talking. So I would just say communicate really clearly with your team about what your religious beliefs are and what the parameters are. They should work with you, hopefully, but recognizing that if you're going to be a collaborative partner in your treatment, that means you're going to need to complete the meal plans that they recommend for you. And so if that is your fixation, then it's something other than a religious concern.
Yeah. All right. Well, we have hit the top of the hour, so I want to thank you so much for joining us, Dr. Lester. Again, everybody, if you joined us partway through, the book is Famished. It's an incredible book. Check it out. It's featured in the Anid Book Corner this month. Dr. Lester, I want to thank you so much for everything that you're doing and for taking some time to join us today. And this is just the first of another conversation we'll have a little bit later on. So stay tuned, everyone, for more details.
Thank you so much for having me. I think it's really important conversation. So thank you.
Thank you so much. This was really, really, again, validating and important for so many reasons. I look forward to the next one.
All right. Take care, everyone. Thanks so much for joining us.